In Alaska, 52% of our population is self-employed in some form or another, or employ. They're self-employed and employ many individuals. And again, I'm pleased to be back here with our freshman colleagues to talk about why America needs health insurance reform and why we need it now. Last week, we busted the myths being pushed by the opponents of reform. Today, we join forces to describe the undeniably positive aspects of reform, how it will help our friends, our neighbors, and our loved ones. Mr. President, I rise to address the unquestionable link between health insurance reform and economic recovery in America. All of us on this floor have heard from those who say we shouldn't do health reform now, that with the economy still hurting, we would wait and should wait. Some of that commentary comes from loud and angry naysayers, looking for any excuse to kill reform. But that concern has also been raised by average Alaskans at our town hall meetings. It is a legitimate question, and here's how I answer my constituents. If we want to do this right, economic recovery and health reform have to go hand in hand. You can't really have one without the other. Now, there's always signs in this country of our economic turnaround in progress. That's welcome news for the American breadwinners going back to work, for businesses racking up new sales, and for manufacturers ramping up production to fill new orders. But there is more work to do, more progress to make. That's where health insurance reform comes in, because the status quo is directly at odds with the possibility of continued economic growth. Here are just a few examples. Businesses, big and small, have been saddled with skyrocketing healthcare costs for their workers. And you've heard many examples this morning. The average health insurance premium in Alaska has risen 102% in the past decade, more than doubled. No matter which state you're from, those premiums increase take a toll on business. Money that could go to innovation, investment, pay raises, or added staff is going instead to insurance. Today, employer-provided family premiums in Alaska average more than $14,000, about the annual pay for a new minimum wage job. Household budgets are also strained. In this decade, healthcare costs for Alaska families have risen 5 times faster than wages. That's a loss of purchasing power that could be going instead to our local economy, or to education to improve individual earning power. Of course, my Alaska examples are happening in states all over this country. Mr. President, the statistics are troubling. Today, 1/6 of the entire American economy is devoted to healthcare costs. Think about it. That's more than $2 trillion each year that doesn't go to job creation or business innovation or investment in infrastructure. If we do nothing, if we do nothing to reverse this trend, if supporters of the high-cost insurance manage to kill this reform, this problem will get much worse. By the time my 7-year-old son is raising his family, 1/3 of the entire U.S. economy could be consumed by health care. You know, yesterday I heard on the floor here one of our colleagues on the opposition to health care reform put the prop, which we'll see over and over and over again, the large bill put on our desk and patted on it. It's about 1,500 pages of the finance bill, and over time that will change. But when you think about it, 1/6 of the economy will be decided by that bill, 1,500 pages. To me, that's a small amount of work in the sense of the legislation to deal with 1/6 of our economy. But again, we'll see that prop over and over and over again. But I hope the American people will see through that and see how important dealing with 1/6 of the economy is, and having a bill of that length is important. How can we expect American businesses to shoulder such costs and truly competitive in the global market? Here's just one example. Right now, General Motors reports that healthcare spending adds $1,500 to the cost of every car it produces. Of course, its chief overseas competitors don't have to worry about healthcare costs because their countries have dealt with this years ago. We can and must do better. Economic peace of mind is fundamental to our democracy. It is the goal of every family in this country. It is the cornerstone of the American dream. And so, Mr. President, let me say again, if we are serious about economic recovery in this country, then we must be serious about health insurance reform. It's a package deal.